I am Dr. Lalit Mohan Parashar. I am an ENT specialist at Apollo Spectra at Nehru Place, New Delhi, India. For quite some time, I have been wanting to talk to you about one peculiar situation that people, when they have headache, what do they think of? The most common cause of headache, to your surprise, may be electrolyte imbalance. That is, like in summer months, May, June, when it is too hot, we get exposed to the heat and therefore sweat a lot. So we lose electrolytes and fluids from the body. So the easiest way to control such headache or to treat such headache is we simply take a lemon water or even salt water. You please try it next time you have headache and you will see the gratifying results. Whether it is summers, hot summer or months of July, August when we have rains in India and so-called humidity, and that hot and humid climate again makes us sweat and sweat and sweat once we are out of the AC room. So over here again, loss of electrolyte and fluids is the reason for headaches. But somehow, whenever we have headache, we don't think of these simple reasons. Instead, what the general public starts thinking about is this headache could be because of stress. I have not slept properly. My life is under so much of stress, and therefore I'm not able to relax, and maybe this is leading to the headache. Yes, there are wisdom in to some extent in all these things, but generally speaking, whenever you have headache, yes, you should take it seriously. One, the headache lasting very few minutes, lasting less than half an hour, maybe 15 minutes, is not generally very significant, so you can relax. Whereas the headaches which are consistent, persistent, which are lasting for more than 30 minutes at a stretch, and then again are coming in clusters. Sometimes days on end you have headache, sometimes you wake up with headache, sometimes you have headache during work hours. So all these situations you have to have an expert opinion. Now, the other simple causes of headache which come to mind for people to get medical access is your general physician can check your blood pressure. Hypertension is a known cause of headache. Also, hypoglycemia of some kind, like in diabetics or even in not in non-diabetics, whenever you have sugar level low, the hunger may present as headache. So you have to pay attention that yes, this headache could be because of these reasons. Also, your GP has to think in terms of what else could be wrong in the body. If there are accompanying symptoms like fever, runny nose, sore throat, then of course you can think in terms of an ENT headache. Similarly, hypertension, headache persistently at any level in the head has to be thought of that why it is not going away for weeks on end, for days on end, for months on end. Then we have to think in terms of maybe something grossly wrong with the body somewhere, and sometimes even the brain tumor can be the end result. So all these situations we have to keep on escalating our level till we get the relief. So as I always say, thumb rule for all of us is whenever you have any abnormal situation in the body, please contact your general physician instead of simply relying on what we call homemade remedies. Homemade remedies have a certain role in our lives. We have all learned this is the conventional wisdom, and therefore there is some merit to it, but we should not rely too much upon this. So, simple thumb rule is for any problem you have a right abnormal from normal deviation, you should wait for 2 days about your own remedies, homemade remedies, which your family tells you, which your elders in the family tell you, or which come to your mind, or which you have maybe got from internet. Beyond 2 days, it is better that you get a professional medical help. At least a doctor would have gone through you, a doctor would have checked you for certain underlying diseases which otherwise may go a begging. We may not even know about them, and then you may have very bad consequences later on in life. Having said that, if your general physician, with all his experience, his or her experience, tries to treat you and still you are not getting relief, at about 2 weeks' time, it is a time to get a professional help more professional help, that is a specialist. The first call of port generally should be a physician who is well versed in the ways of body. We call them internal medicine doctors, and generally they are able to direct you to the proper specialist if required, whether it is neurologist, whether it is endocrinologist, whether it is ENT specialist or someone. One thing more is I wanted to say for quite some time that my specialty gets ignored as far as diagnosis is concerned. In headaches, in vertigos, people tend to think of every other malady before coming to an ENT specialist. So this educational Facebook Live is basically to tell you that even the ENT causes can lead to headaches. Generally speaking, whenever people have headaches, and especially people with a long history of headaches and long history of family history of headaches, tend to think in terms of a peculiar term called migraine. Somehow, people have a very good tolerance about this migraine. You label their headache a migraine, and they, for years together, keep on suffering without getting a proper treatment for it, with a proper diagnosis for it, proper underlying therapeutic ways about it, because migraine is there and migraine doesn't go away. That is the general refrain. So what I would like to tell you is that so many patients we see who have not been say labeled properly as migraine, but since the doctor says it is migraine, patients tend to believe that it is migraine, and the story continues, and therefore they keep suffering. Giving one example, only last week I had a patient who was about 27-year-old boy who was suffering from headaches since his childhood. He was say about say 15 years then, and he said since the age of 14 I am having headaches and it is migraine. So what to do? I can't do anything. He had come to me for some ear problem. Now examination revealed, surprisingly, that he had some problem in the nose, that is a deviated nasal septum, as well as a growth in the nose, which we call polyps, which is allergic polyps. Now, simple fact was that if any person would have got a CT scan of the nose sinus done, and the headache would have been cured. He's a young man. His headache was cured eventually. Just yesterday we did the surgery. The septum was made straight and the polyp was taken out. Films and videos are available, but generally while talking to you, I'm not using too many of these resources to not to bore you. But simple point is that yes, uh, such headaches which get labeled as migraine. Migraine is a diagnosis which should be reached only when the person has exhausted all other physical examination and still doesn't know what it is. There are certain characteristics to this that whenever patient has headache, one has to look whether there are any attending other symptoms or not. If you have headache and you are feeling unnecessarily tired, as I said, electrolyte imbalance could be the reason. If you have headache and also fatigue, and you know that you have been overworked and did not get sleep properly in last night, yes, your stress could be the reason. But if you have headache and four cardinal signs about the nasal symptoms, then you should think in terms of whether it is a ENT related headache or not. So that is what the main topic for today was, that whenever you have headache, we should be looking at the underlying disease, and underlying disease can even be a nasal disease. So the things which hallmark about the nasal illness could be, there could be nasal blockages, either one side or both side, or persistent blockages when you have to open the mouth and breathe. Second, one can have discharges from the nose, whether it is coming out from a front or person is sniffling and taking it inside. So these are the nasal discharges which should alert you that underlying problem can be the nasal rather than just a headache. A third thing is sneezing. If it is accompanied by sneezing and also watery running nose as well as watery eyes, that will simply tell you that it is the underlying nasal problem which is causing the headache rather than anything else. And of course, the fourth hallmark is not only headache but the frontal or facial pains, as well as heaviness of the head, as well as pain going to temples, pain going to parietal region, pain going to back of the head, as we call occipital, or of course frontals are the most well known thing. So with all this, we can make a diagnosis that yes, clinically it seems that there is a reason to believe this patient might be having something wrong with the sinus problem. Now, once you suspect any kind of sinusitis because of a nasal disease, you should consult an ENT specialist. And we, of course, will be too glad to host you at our Apollo Spectra in Delhi Nehru Place. Our ENT specialist, me and my colleagues, would be looking at your nose. We can look inside the nose and throat and infer whether we need to investigate any further. In the nose, we are able to see whether there are bloated swellings inside the nose, and there is a midline bone we call septum. This septum could be to one side or to the another. Therefore, whenever you are breathing, air doesn't go in and come out completely in a streamlined flow and takes a turbulent airflow. That leads to extra secretions which can present here or which can be sucked in back. Also, opening the mouth and seeing the back of the nose also tells us whether a person is ingesting regularly the phlegm coming down in the throat or not. Now, once we know that this is a sinus problem, the next logical question is understanding what is sinuses and what is sinusitis. There are few terms which are confusing to people. People come and have another label that I have sinus. Now, yes, we all have sinus, but that is a normal thing. Sinuses are the hollow bones which nature has provided to our face on both the sides of the nose. They are attached to the nasal cavity, so they are part of the nasal sinus disease. But nose, the sinuses are basically hollow. Simple example I give you is why do we have sinuses or the hollow bones in the face? You must have seen a bullock or a cow. It has got this thick neck. Now they don't have sinuses, so the head is very heavy. All the bones are very thick. There is no hollowness in the bones to support such a neck, such a head, which is very heavy. They have to have muscles all over their neck. So you can't have Surahidar Gardan or the very beautiful neck we mankind have. It is only because we have hollow bones that we can have such beautiful neck. Having known this, that now there are hollow bones, two here, the called frontal sinuses, two here called under the eyes, these are called maxillary sinuses, and then 15 to 20 sinuses between the eyes, they are known as ethmoidal sinuses. There is another set of sinuses at the back of the nose, it is called sphenoid sinuses, which is just under the brain, almost at the midway mark between the two ear points. Now these sinuses are hollow cavities. They are lined by the same pink skin we have inside the nose as opposed to the outer skin. This outer skin is called dermis. The inner skin is called mucosa. All this mucosa anywhere in the body, whether it is the eye, whether it is the nose, whether it is the oral cavity, whether in the intestines or lungs, is moist mucosa, moist covering. It has to have certain secretory surfaces which keep on producing mucin, keep on producing secretions, serous and mucin, that is watery as well as thick secretions. These keep it lubricated, they don't dry up, therefore they are working for our other purposes. Other purposes of these sinuses are, apart from lightening the burden of the head and making the neck muscles less tiresome, they also work for making the resonance of our voice. Whenever we speak with the vocal cords, we all know. The same sound is modulated by our lips, teeth, palate, tongue, and the rest of the muscles in the mouth. These come out with the legible sounds, what we call speech, and therefore we are able to communicate as I am communicating to you. The spoken word has characteristics. Similarly, the songs we sing also have certain characteristics. Here, the importance of the sinuses comes up. These sinuses make all our sounds resonate through the sinuses. So, therefore, they impart pitch, timbre, and uniqueness to our spoken word. So much so that even properly seeing them, the graphs of our sound generated, we can discern whether this person is speaking or the other person is speaking. Just because, like overseas, so much of sound is conducted, so much of information is conducted in the sound that even overseas transatlantic, a mother can just hear the child to say hello, and mother would know that child is hungry, child is in stress, child is happy, child is cheerful or not. So much of information is carried out, but all this is imparted meaning by our sinuses, which are hollow and resonating whatever we are saying. So they have a role in our body. So these sinuses have to be moist all the time. They have to be producing secretions all the time which are normal level. Normal secretions tend to come into the nasal cavity, some in the front half of the nasal cavity, some in the back of the nasal cavity, but eventually all the nasal secretions are going to go down the throat, which we occasionally, when we are awake, keep swallowing. Even in our sleep, we keep swallowing, but not that frequently. Now we are coming to the disease part. Why does the disease of these sinuses occur? Incidentally, once you have any disease of the sinus, it is called sinusitis. It is not simply a sinus. So either we say sinus problem, which will mean a disease of sinus, or we say sinusitis. These are two depictions of the word. Simply saying that I have sinus would simply mean that yes, you have a anatomical part of the body called sinus. And now we know that these sinuses are hollow bones and they can have disease. The disease in the sinuses basically arises out of certain situations in the body when the flow across the nose is not good because of any reason. The reasons for these could be the flow because of septal deviation, septum is not straight. So the flow from both the sides of the nasal cavity, right and left, is not a streamlined flow of air in and out. That is a turbulent airflow that will lead to extra secretion formation. Extra secretion in the nose, of course, will be going down the throat, but also will impede the normal secretion from the sinuses from reaching down because already the drainage system is inundated with too much of secretion. So we have a situation where sinuses tend to collect fluid. That is called sinusitis. Initially, given some chance, like we have cold or URI or viral infections, we all know, we all get about 2 to 2.5 episodes of sore throat and cold every year, and the reason is viral. So, what we start with is a sore throat starting in the morning, and by the evening, it is copious amount of secretions coming out of the nose, which is generally watery, nose, secretions coming down the throat, and then also the secretions filling up the sinuses. That is the time one has heaviness of the head, one has sneezing, one has other symptoms pertaining to nose, and we know that we have to take treatment. Generally, we say about the cold that you treat a cold, it takes a week, and if you don't treat, it takes a 7 days. So either way, we with the medical management and treatment can simply ensure that person does not go into complications of this sinusitis. Given a time to 5 to 7 days, secretions stop getting extra secretions, viral load decreases, body tends to control the infection, and at about 5 to 7 days time, the secretion which were too much tend to decrease, and therefore the sinuses which were full of secretions generally tend to dry out and come to their normal level. So we no more feel bloated, we no more feel headaches, we no more feel the blocked head or heaviness of the head. So we start feeling normal. So this is one very simple example of how sinuses get involved. The other ways where sinuses can get involved is when our body reacts to the atmosphere or something we are exposed to too much. That thing is generally called allergy. Again, allergy is something which people don't understand but use the term very loosely. What we have to know is that a person has to get exposed to something in our inhaled allergies, something in the air we breathe in and out. The air we breathe in can carry particles from our atmosphere. Particles could be dust particles, dust mite. Particles could be pollens, could be dry leaves, could be flowers dried, or could be so many other things which are polluting our atmosphere. It could be even carbon particles, could be soot, could be automobile exhaust, could be gaseous elements. They all can be going and hitting inside, pink skin being very delicate inside the nose and sinuses. It is all the time exposed to our breathing because we don't stop breathing. We breathe all the time. So this irritability of the skin, when body overreacts to this is called allergy. Thereby meaning that whenever we are exposed to something, body perceives this thing as harmless thing going into the body. Like we drink clean water, we are happy. If we drink bad water, we immediately throw it back. Similar in the nose. Whenever body perceives that the air going in is fresh and we are happy about the air, like we all go to hill stations or very pure environments, and we feel so happy, fresh at the seaside, and there is no problem. But there are people, whenever they inhale something in the city, especially, we have so much of irritability in the nose that body tends to overreact, and now person is down with what we call allergic rhinitis or allergic sinusitis. Allergic rhinitis being that person tends to, body tends to perceive this thing as causing injury to the body. So before the thing will cause injury, suppose a dust particle, suppose a soot or carbon burnt material or leaves burning, these things will cause some problem to the body, and body can handle that. There are mucin secretions inside the body. Generally, they can clean them up. There is a system of the body which keeps cleaning everything, and therefore we don't have any depositions too much. But a person who has got allergy will react differently. The person will have copious amount of secretions coming in the nose, copious amount of bloating of the underlying mucosa or the skin. Skin gets thickened. There is a very small aperture available to us. If both the sides get swollen, we have blockage of the nasal passages. If both the sides of the mucosa start giving too much of secretions, all our cavities will be inundated with secretions, and we have full sinuses, full nose, also dripping nose coming out from front or back. So we call it allergic rhinitis, allergic rhinosinusitis. Incidentally, these terms we give to the diseases pertain to which part of the body is ill. If we have problem with the nose only, we call it rhinitis in our parlance, basically the Greek word. Similarly, if you have problem in the sinuses, we call it sinusitis. If you have both the things together, we call it rhinosinusitis. And of course, going down, it can cause pharyngitis, it can cause laryngitis, it can cause bronchitis, and so on and so forth. So basically, issue is that one thing we discussed is from normalcy and body's normal reactions to body's abnormal reaction, which is allergy. Allergy in people, those who are prone to it, tends to go for long time, and therefore over a period of time they tend to develop secondary problems with allergy. Thumb rule is any chronic neglected allergy will lead to polyp formation. So let's understand what polyp is. We understood that there are extra secretions in the nose in response to something we are inhaling. Now that extra secretion will either come out or will go in. Simple. Other thing is, if you have secretions over the mucosa for quite long time. A simple example is, once you have washerman, you wash clothes and your hands start looking different. That is called washerman skin. We all have seen when we swim, we wash clothes, we do whatever with water too much, and we have this. So inside is supposed to be a normal looking healthy pink mucosa. If it is too much of secretion all the time, it stays at a place for very long. What will happen is underlying mucosa will start getting bloated, start getting thickened. So this thickened mucosa will lead to eventually extra secretions and then extra thickening. Eventually, the pink color will be lost. Whatever the thickness is will start presenting as grape-like swellings we call polyps. As long as it is pink and the skin is just thickened, it is reversible. The moment it turns gray, inside the nose we see, or inside the sinuses with the endoscope we can see, if the things start turning gray, that means it has gone on for too long and now it is no more reversible. So the person having a long standing allergy which has been neglected or not treated properly will eventually lead to polyp formation. Polyps can be in the nose, filling the nasal cavity, so there will be obviously blockage. Similarly, the polyps can also block the sinuses, so underlying sinus will have secretions and will contribute to the whole problem, and may again get full of the polyps, as well as sinuses can present as heaviness of the head, headache, bloatedness, and person can feel miserable. Similarly, the polyps can keep on growing over a period of time. Generally, they tend to grow backwards and fill up all the nasal cavity, coming down in the throat. Sometimes they are visible when you raise the palate, so that it is hanging from above. But mostly, they are confined to nose and sinuses, so we call it a nasal sinus disease. allergic rhinosinusitis. Sometimes the cause is even fungal infections. So over there we call it allergic fungal rhinosinusitis. Yes, all these conditions we talked about, wherever sinus gets involved in any kind of illness, it can lead to headaches, and therefore, in all our illnesses, since they are so common illnesses, we should always be looking at the underlying sinuses. Before I take it any further about the causation of sinusitis, let me tell you how do we look in the sinuses. One is sitting in the cavity, sitting in the OPD, doctor can throw light by wearing the headlight or torch or any endoscope. We can throw light inside and look inside the nose and know whether it is healthy pink mucosa all over the place or there is some polyp. On the contrary, we can't look inside the sinuses. To look inside the sinuses, we require another kind of vision, which is generally X-ray vision. We all know, we have seen X-rays. X-rays are the modalities where we throw light, which is the X-ray light, and those rays are captured by the photographic lens, and we also take it on transparencies or nowadays digital. So we tend to get to know that sinuses are hollow cavities. We can photograph them by the help of X-ray vision. Generally, X-rays were used, but nowadays increasingly we are using CT scan. CT scan means we can have asked the computer to take X-rays of this place. CT scan literally meaning computerized tomography. So the computer takes X-rays of this whole place, as we tell them to take CT scan of sinuses, and gives us the picture as if someone has taken sinuses like that. That is sections from front to back, sections from below upwards, sections from this side to that, so that we can three-dimensionally know the thing. There is another entity called purulent rhinosinusitis, that is infection causing sinus disease. These infections are the ones which can lead to more complications. The two things can be coexisting also, that is allergic rhinosinusitis and infective rhinosinusitis can be coexisting in the same place. For example, a person who is having a long-standing sinus disease and has polyps can also have infections secondarily whenever he has exposure to any infection. So now we have a situation where the person has sinuses which are full of either secretions or polyps, and we also have pus adjoining. So this pus tends to go into the areas where it's not supposed to reach, and therefore person can start landing in complications. Similar infections can be either bacterial or fungal. Bacterial infections will cause miserable headaches, cause fever, will cause pain all over the body, which can cause specific pain. One can point out this place or that place or that place. But also, there can be fungal infections of the sinuses. Fungal infection tends to keep growing. Basically, it is body's reaction to the fungal infection, and now infection is present inside the body, which is fungus, and body is reacting to the fungus by producing extra mucin and extra polyp, and therefore polyps keeps on growing. Now we land up in complications by infection going either into the eye from the nose, or going into the brain, or going into the throat or bloodstream or lungs. So we had seen very common example in the last COVID epidemic. There were a lot of cases of black fungus, as it was called. Basically, it was not black, but what it led to was the infection spreading from the nose to the eye, to the brain, to the other parts of the body, and the bones were sort of eaten out and therefore were looking too black because they were not getting proper blood circulation. The healthy pink color was gone, and the underlying bone getting exposed was causing blackening. That was called black fungus. But even otherwise, in our everyday practice, we see people who don't take proper treatment for their headaches or their sinusitis tend to have complications of the same polyp going into the eye. So the eye may start popping out, eye may actually bulge out, two eyes may start looking dissimilar, one sunken in and other sunken out, or one normal and other coming out. These generally are accompanied by excruciating pain. Since it goes to the eye, it has the potential to cause blindness also. It can cause visual disturbances. It can cause looking double, with double vision we call diplopia. When person tries to look here and there and suddenly start seeing things in double. That means both the eyes are not moving conjointly or as they are supposed to move simultaneously. in this or that direction. That can lead to double vision. Similarly, infections, brain is almost here between the eyes. It starts and dips in the nasal cavity. So the roof of the nasal cavity or the sinuses is the roof, is the floor of the brain. So any infection which crosses this small bone can lead to infection in the brain, and we can have again lethal complications apart from the headache. We can have infection reaching the meninges, meningitis. We can have brain abscesses. We can have encephalocele, things like that. So in all these things, and uh, I also want to point out that sometimes accidents and even playing injuries are quite common. Person may have an injury in the childhood where the bone has got some fracture. Later on in life, person can have infection in the nasal cavity, and then infection can travel through those pre-formed cracks, the fracture healing by fibrosis. So there is some gap between the bone, and infection can travel from there, from one cavity which is the nose to the other cavity which is the brain or eye, and can lead to again complications as we thought of. So I wanted to suggest to you people through today's talk that somehow people tend to ignore headaches. Once you have headache and you have any kind of nasal symptom, don't simply brush it aside that it has been there for very, very long, so therefore I should not be worried. Any symptom which has been there for even a long time still merits proper, thorough examination, clinical history, as well as diagnosis, and diagnostic tools available to us very easily. The CT scan which hardly takes, one should not be afraid of it. Just within one or two breaths through these days, there are advanced CT scans which give us all the information about nose and sinuses, and based on that information, your doctor will be able to think out a better treatment strategy, whether it is treating you with medicine or whether advising some kind of surgery. The surgery to nose and sinuses is required can be done via nails only. Nowadays, we don't resort to cutting open and thing. There are no scars on the face. Whenever we do the nasal surgery, we simply put the person under anesthesia. We go via this nose, open up the sinuses, clean the sinuses, and in the end, give a clean passage to the nose without any septal deviation and without any other hindrance in the way, and therefore person is able to breathe completely free without producing extra phlegm, and therefore person is relieved of all the symptoms. With these, I think we should call it a day. You would have understood this. You can always revisit this Facebook Live, and any points which you have not understood properly, you can again understand better. And of course, you are free to talk to us via our Facebook Live. You can give questions. We will be duly answering them due course of time. Please be on the lookout. Thank you very much. Thanks for being such a good passive listener. Thank you.